All right, I am here with Dr. Meichsner, and we are going to talk a little bit about tongue ties and lip ties because it is a little bit of a controversial subject out there. If you go and Google these things, you'll see lots of different things pop up. So, what are kind of your thoughts on tongue ties, lip ties, those things?
Well, we know that they do exist and that they interfere with the ability for newborns and infants to latch and feed appropriately. But there's also some newer evidence that down the road in life it could cause other issues, speech delay. There's some concern about whether or not they cause or contribute to sleep apnea. And so I think it is an issue that's becoming more mainstream, and that people are realizing, yeah, this is really a problem, and that we should address it in these little ones. And it's a personal issue for me, being that we just had my little guy here, his revised, and are seeing the benefits of it as well.
Yeah, and so like in your kids that are a little bit older, do you think that maybe they had some issues too or not?
Yeah, I do, looking back, as a first time mom with my first son, I think he does and does have it, but it wasn't quite recognized, and I didn't recognize it. And now with my third kiddo here, it was quite obvious as I've learned more the past few years.
Yeah. So once with these ties, is it something like if they notice like speech issues later on, is it something where they can still cut? And do that?
So in the hospital setting, we sometimes realize these, and we'll do just a scissors cut prior to hospital discharge when the baby is born. Rarely do we do it, say, on a 9-month-old in the office, just because it's difficult. Those get referred out. But also what they're doing now is more CO2 laser treatment, and that's what Camden had, because his was pretty extensive. So they're both cutting and doing laser depending on how significant the tie is and where it is. If it's a lip tie, if it's an anterior tongue tie or a posterior tongue tie, it all makes a difference. And then also taking into consideration, what effect is it having? Is it a functional issue in terms of them feeding effectively? And if so, then it's something that should be done in infancy, or is it something that we can wait and see about later? But they are treating infants, children, and adults with the CO2 laser now pretty regularly.
Okay.
And it's done mainly by dentists, pediatric dentists, oral surgeons are the ones doing that. Some ear, nose, and throat specialists are starting to do it as well. And it is becoming more of a mainstream treatment, conventional therapy.
Okay. What if you're told that they have a tongue tie or a lip tie, but you don't see much for symptoms? Is it something like where you would wait to see what develops before you do anything, or?
Yeah, so that's where the controversy still exists.
Okay.
There is a subset of people that say no, do it when they're young, so that you don't run into the problems. While there's a whole other group that says let's wait and see.
Okay.
So I don't think that there is standard of care on that quite
Okay.
yet.
Okay. Yeah. Is this something like when a kid is born somewhere out here, say out here in rural America, is it something that's going to be noticed like right away in a hospital setting, or does it depend on the doctor, or how do people find this out?
Well, if it's a really significant one, it'll be noticed in the hospital.
Okay.
But sometimes it's more of a functional defect than an anatomical. And what I mean by that is, you might say, oh, well, maybe they have a lip and tongue tie. And that's what I thought when he was first born, but he was also premature, and I said, let's just see how it goes. And then when we realized there were functional issues, so his latch was poor with both nursing and bottle feeding. He couldn't take a pacifier or hold it in his mouth. He would click a lot when he would feed. He was very refluxy, but that was because he was swallowing so much air with his feedings, just fussy, things like that.
And the swallowing air can be because of the tie, right?
Yes.
So when they're starting to suck and things actually don't have the proper sucking motion because of the tie, right?
Yeah, so the tie makes it so that they can't suck and swallow effectively. A lot of times they chomp with their jaw rather than using the tongue motion to transfer milk from the front to the back of the mouth. And then they end up swallowing a lot of air. And so, we get people coming in saying, well, my baby has reflux, but it's not always that simple.
Yeah.
A lot of times it is, you need to look at why they have reflux.
Yeah.
And figure that out rather than just, I guess, blanket treating it.
Yeah, that's good advice. Is there, so let's say if someone suspects that maybe they have a tongue tie or their child has a tongue tie issue, where would you tell them to go? Is it somewhere they can come see you, or what kind of advice would you give them that way?
Yeah, so it's good to get a thorough evaluation both of the anatomical tie and the functional, how it works.
Okay.
And so, yep, definitely we see these, and then we end up referring if needed to where they need to go. But there are pediatric dentists that are doing this all over the state of Minnesota, but also up in Alexandria is the local, or closest, I guess, place to go. And they're very experienced and kind of experts in this actually up there. So we're very fortunate to have that availability.
Yeah. Well, that was great advice. Thank you for that.
Yeah, you're welcome.
And thanks for watching, everybody. Hopefully that helps out.